So I'm going to be somewhat brief. I think the introduction slide here is fairly busy, and a lot of you can read it, but it sort of emphasizes nerve dysfunction is a real tremendous problem for patients near and far. Microsurgical reconstruction is relatively in its infancy, beginning in the 60s and 70s, where they were actually dividing suture themselves because 9-0, 10-0, 8-0, which are commonplace now in 2023, were absent in the 60s. I think it's important to understand nerve injury classification by Sutherland, where you have a neuropraxia, which was sort of grade 1. That's kind of like if someone hits your funny bone, as patients would describe it, down to the 6th degree, where you have a mixed injury nerve, which is completely transected, and everything in between. And certainly we've learned that obviously the greater the nerve injury, the worse the prognosis. And in 2023, we're trying to improve our ability to manage these nerve injuries, where lots of research is ongoing and needed. So known challenges, certainly I would love to have a young patient rather than an older patient. Those nerves do tend to do better. Healthier patient also does well. An injury that we've heard this before that is less chronic will do better. Nerve injuries within the first 2 weeks do much, much better. We are learning a little bit about nerve injury in the tissue bed. Papers coming out regarding just damaging the bed around the nerve in rats